Hello, everyone. My name is Miranda Marvin. I am the school director here at Paradigm Development Center. And
I am Lauren Marvin, lead teacher here at Paradigm Development Center.
And we are also the founders of PDC. We are very excited today to host this community education session. As educators and parents of a teenager on the autism spectrum, this is of great concern to us, as I'm sure it is to all of us. Lauren has already done the housekeeping. Is there anything else that you would like to add?
The other part to what we've discussed prior with Dr. Holly is that any questions that are kind of formulated by you during this presentation, if you can just jot those down and send us an email, we'll try to personally answer those after the fact so that we still have a great presentation for people to view online, okay?
Yeah, so go ahead and send the questions the same method as we did before to Team Paradigm Houston 3@gmail.com, and we will forward them to Dinah and Dr. Harris. So without further ado, I'm going to introduce our amazing speaker. Her name is Dr. Holly Harris. Dr. Holly Harris is a developmental behavioral pediatrician at Texas Children's Hospitals in the Meyer Center for Developmental Pediatrics and Autism. She seeks to provide family-centered and evidence-based clinical care for all children with neurodevelopmental challenges. She is also the developmental pediatrician for the Angelman Syndrome and a member of the Fragile X Syndrome Subspecialty Clinic. Along with providing diagnostic evaluations and ongoing care for parents, she is also involved in research activities alongside scientists at the Neurologic Research Institute studying autism spectrum disorder. She regularly teaches medical students, residents, and fellows through didactic sessions and through supervising in the clinical setting. Without further delay, Dr. Harris.
All right. Well, I am going to try to share my screen without causing too many technical breakdowns. Okay, can everyone see? All right, awesome. I'm not the most tech savvy, but hopefully this will work. It really is a privilege to get to speak to you all today about everyone's favorite topic, puberty. I am by no means an expert on this. However, I do hope that by the end of this, I can give you some general early guidance and definitely point you to ongoing resources as you navigate this with your child, friend, family member with neurodevelopmental differences. So it goes without saying that puberty is hard at baseline for any teenager. I like to have this brain up there because it reminds me that this really is just a part of normal development for anyone. So this back part of the brain is in charge of our vision, our sensory, some of our sensory areas that kind of develops first. Then the parietal lobe and the temporal lobe develop next, and those are responsible for processing sensory information, memory, emotion, hearing. And that's really still immature until age 16 and even beyond. And then this frontal lobe up here that you guys may have heard about is kind of the CEO of the brain, the thinking center, controls our decision making, and it is the last lobe to mature, and it's just going on into young adulthood, is taking its time to mature. So that's why puberty in teenage years are such a hard time, because all of these emotions and this area of the brain that controls emotion is really coming online, but they don't have as much decision making capacity as we would hope. And that's true for any teen. Not only that, but you're having biological changes. So our biology is changing. They're having to realize the importance of hygiene and self-care. And then peer relationships are changing. Things are getting a little different in their peer groups. Peers and their perceptions are becoming more important. And they're managing this range of complex and intense emotions. And we all know change is hard for any of us. So this is what's going on for everyone. And then on top of that, children with neurodevelopmental differences, obviously there are a lot of other factors that make this an even more challenging time frame. One primarily being that if there are developmental delays, this normal process may be even further delayed, thus causing some confusion. I'll also say at the beginning, you all have excellent questions. A lot of you have sent in questions beforehand, and I was really so impressed about your thoughtfulness and what you're already thinking about, and how it really did align with exactly the things that I think are important to talk about when we think about this topic. So and when I read through them, your questions kind of clustered um, in a few main areas. So first of all, what do I expect in terms of biology? We all went through puberty. It was a while back. Remind me, like, when am I expecting certain things to happen for my child? Um, a huge category was, how do I talk about this? How do I even go into it? Where do I start? When do I start? And then also a lot of questions about, what do I do about inappropriate sexual behaviors? And this is, I guess I'll say right now, a very common thing that we hear and that we counsel families on, because those behaviors may be driven by several factors. The sensory driven repetitive behaviors are driving some of those, but there may not be the developmental level there for the child to realize it's not appropriate in certain settings. So this is something we hear about often. And then lastly, everyone said, what are resources? Where can I go to learn more? So hopefully by the end of this talk, you will have a good sense of all of your answers to all of those questions. Okay, so Puberty 101, we'll do our quick biology review at the beginning. So what is happening during puberty? So it's a time of rapid linear growth, so growing in height, weight and body composition changes. Females put on a little more body fat in their hips and breasts, and then males are gaining a little more muscle. Females gain muscle too, but it's a little bit different if you're a guy versus a girl. And then on top of that, you have the sexual maturation that I think a lot of us think of right off the bat, and then rapid bone growth. And so that can raise risks for various things that we'll talk about that you can keep an eye on. And then the second question is when should it happen? And I will say at the upfront that is very variable. It often is a little bit based in your genetics, ethnicity plays a big role. And then overall, we're trending toward earlier timing in general. It's kind of the trend that we've seen for kids. So because of that rapid growth, both and then the body composition changes, there are some potential problems to look out for just from a medical side. So one thing is earlier delayed puberty. So is this happening too early or is this happening too late? And we'll talk about some ages to kind of put in your mind. In women, we always think about anemia, making sure that they're getting enough iron, that their menstrual flow is not so heavy that they are perhaps becoming anemic. Acne for a lot of children will then show up at this point due to the sweat glands, activating the hormones coming online. And then there is a risk of either, if your child already has a degree of scoliosis, of that worsening, or of musculoskeletal injury just due to all of the growth that's happening during this time. So definitely should be getting, regular exams at the pediatrician that are monitoring all of these things. So for boys, we think of, quote unquote normal. And I always say that with a caveat, because there's always a child on the that's really early or really late, and it's all still normal, but most will start puberty around 11 years of age. It's abnormal to have testicular enlargement before age 9. Again, it may be that you get that all worked up and it's okay for that child in particular, but if you see testicular enlargement before age 9, it's something worth bringing to the attention of your pediatrician, and it may require further workup. Or if your child has no changes after and is 14 years of age and has had no signs of puberty, that would be another reason to alert your pediatrician or maybe ask more questions. And then another normal part of male puberty is nocturnal emissions, or colloquially we call those wet dreams, and those happen between 13 to 17 years. And as awkward as it is to talk about some of these things, I just say it out loud so that we all know it is a normal process of boys' pubertal development, and it's out of their control, and it's something that will happen and that unfortunately we may have to deal with as parents. And then for girls, so normal puberty, Usually the average age for breast development is between 9 to 10 years. If if you see breast development before 7 years of age, that's again a reason to maybe let your pediatrician know you have some concerns. And then the mean age for them to start their period is about 12 years. And then again, if they're starting their period before age 7, even ages 8 and 9 might be a reason to alert their pediatrician, or if they have no period by the time they're age 15. So those would be reasons to think about, is there something going on with the hormones that we need to do further testing for?
I don't remember. I think I was waiting until you were 16.
Oh, does someone have a question, or someone
I
just
think
not?
it's probably changed in scientific facts over the years.
Okay. So again, these are all kind of just overall parameters, and there's always the exception to the rule. And a lot of times, parents, if they think back to kind of when they started puberty, it's usually similar for their child. So specific to females, so what would be normal for periods? A normal cycle in between periods is 21 to 45 days. And usually the bleeding lasts anywhere from 3 to 7 days. So within that first year and a half after a young woman starts her menstrual cycle, it's okay and actually pretty normal for it to be irregular. So I wouldn't make too much of it in that first year to year and a half. However, after that time, if periods are happening more often than every 3 weeks, so they're happening every 2 weeks before that kind of normal cycle range, or if your child does not have a period for over 3 months, that would be a reason to alert a provider for potential further workup, or if their flow is very heavy. Now, that being said, it's surprising how heavy a period can seem, and it still be normal. The child is fine. They're not anemic. They're doing well. But things like soaking through 5 to 6 pads a day for multiple days, if your child seems symptomatic, like dizzy or lightheaded, those would be reasons to bring that to the attention of your pediatrician. Okay. A common question that we do receive, especially with children with intellectual delays or disabilities or neurodevelopmental differences, is should I use any medications to help with periods? And this often comes up due to the child may not have the cognitive ability to kind of do that daily hygiene or self-care during their menstrual cycle, or a lot of children have pretty significant cramping and pain. And so families start to weigh whether or not this would be helpful. And it's an individual family choice, obviously, based on, you and your child and their circumstances. There are many different options. So there's the pill that everyone kind of has heard about for years, and those contain either estrogen or just progesterone or a combination of the two. And there are risks and benefits of each of those. So that's an option. And then there are longer acting options that exist that you may or may not have heard of. Depo-Provera is the shot that kind of regulates cycles for, or will prevent a cycle for about 3 months. The Nexplanon is an implant in the arm that can last for about, I think, 3 to 4 years potentially with the new Nexplanon. And then an IUD, of course, would be the most extreme, and it would be an intrauterine device, but that would last 5 to 10 years in helping control periods. And so again, there are many more details that go into the medical side of this, weighing risks and benefits. I'm a little removed from my pediatric OBGYN days, so I probably don't even know all the specifics, but this is easily an area where your pediatrician can first direct you, and then if they would like, they could refer you to a pediatric OBGYN who specializes in this area, particularly when considering children with cognitive delays or neurodevelopmental disabilities. Okay, kind of moving on from the biology. I decided to get that out of the way at the beginning, and then now we're going to go more toward some of your questions and like how, on the practical side of things, how do I navigate this? So first common question is, should I talk about puberty with my child, and how? So the answer is, of course, yes, but you're not alone. And really there is a huge responsibility held by the providers and the school to help you in this. I think one thing I would love for you to take away from this talk is that I don't ever want you to feel like you don't have someone to consult about a given issue, or there's always someone where you can ask a question. Your provider, your general pediatrician, if you have a developmental pediatrician for your child, those are great resources. And then schools actually do a lot of work around social safety curriculum, sexual education curriculum, kind of anything from the basic biology to the, how to manage puberty, hygiene, things like that. So it's worth asking if you kind of heard radio silence from your child's school. You can see if they have programs that might be helpful. So I kind of alluded to this at the beginning, but there are special considerations for children with developmental differences and intellectual differences. So what are some of those? And these definitely came across in your questions. So I think the biggest thing to wrap our minds around this is to realize that most children will progress through puberty based on their age, their chronological age, and not their developmental level. So I think that kind of the mismatch there is what really leads to a lot of the biggest concerns that arise during this time frame, because the hormones, the biology is happening, whether or not your child is developmentally ready for that. And so because of that, your child will be curious. Hormones are inevitable. And so when you know that your child's developmental level is lower, however you see them behaving in a way that seems sexually aggressive, that can feel alarming, I think, to a parent. But I think it's just important to remind ourselves that this is biology. These are normal behaviors. And so we just need some ideas around how to put them in the appropriate context or place. Other unique challenges that we see are children with either cognitive delays or autism spectrum disorder have trouble with social nuances and what might be, quote, socially appropriate behavior during this time. Sensory or repetitive behaviors, again, play into some of those inappropriate sexual behaviors. Or just a few of you had great questions around, sometimes children get kind of stuck on a girl in class. Like, I like this girl, I want her to be my girlfriend, and they get a little repetitive in that fixation, and that can be a problem. And then there is the issue of social safety. There's a higher risk of abuse and victimization in children with developmental differences. That is known and in the literature. And so how do we kind of be proactive about being on alert for that, which again, many of you asked questions specific to that. Okay. So this is all great, Dr. Harris, but what do I do? What do I do on the day-to-day? How do I help my child? So if you go away from this talk with one resource, this would be it. It's Vanderbilt's Healthy Bodies Toolkit. And some of you hopefully may have heard about it. If you haven't, I'm happy to be able to alert you to it. The website is there. Again, I can make these slides available. I'll have Miranda, and then the talk will be online. So this will all be available to you so that you can access it at any point after this. But these guides are free online in PDF form where you can print them out, about 20 pages long. Then there's also an appendix, a toolkit with a ton more when it comes to resources, and we'll look at some of them. I will say, before I go into these slides, these are all copyrighted by Vanderbilt Healthy Bodies, so I'm using them through them, and so I just give all the credit to this institution for this resource. Okay, so here's an example of the table of contents. So on the left, these are for boys. The ladies, we are lucky enough to get some additional chapters, but you'll see that the first several, I think the first 5 really are similar. So, oh no, here it comes, the onset of puberty. How do I talk to my child about this? Number 2, no couch potatoes, helping your child stay active. Puberty is a time where, like I said, all those body changes are happening. A lot of times children, maybe whether it's due to medical causes, they might have limits in their activity level, or it might just be that their interests are more gaming or video games. Those iPads can get the best of all of us. So I think thinking about how do we keep them active and prevent them from becoming at risk for obesity during this time. Few, what's that smell? A whole chapter on hygiene and how to help your child learn those skills. He'll please not hear, whole chapter dedicated to the inappropriate sexual behaviors. Peers, hormones, and mood swings. How do you talk to your child about these emotions? How do they get either the pictures or the words to be able to tell you what they're feeling as they start to feel all of the emotions of teenage years? And then some items specific to boys, including erections and nocturnal emissions. And then girls, of course, get to deal with bras and tampons and pads and the female exam and menstrual control. So like I said, this is an amazing resource. And then there's a whole appendix. Again, it can be found online for free, and you can download lots of visual aids. There's also this whole, these topics are also presented in Spanish. I think they're working on Turkish, oddly enough, and then hopefully some more languages soon, but they are in English and Spanish. But I wanted to touch on what I think are a few I'd say two big things when we're thinking about how to help our child during this time. One is talking and the other is visuals. So a lot of what I say will come back to these two concepts, talking and using visuals. And for each child, that might be in a different ratio. You know your child or your family member best, and kind of which way they learn best. But when I say talking, I have 4 basic points. Talk early. Don't, as much as we hate to broach this topic, don't wait. Go ahead and start talking about it, even before it's happened, ideally, because then when all of a sudden these things show up, your child isn't caught off guard, especially for kids who need routine, who need a lot of repetition. You'll want to get this in their minds at an early age. Now, don't worry if you're already halfway through puberty and you guys didn't do that before, it's really okay. There's still plenty of time to help them get acclimated to everything that's going on. But ideally, you'll talk about it early, talk about it often. We all have been through it. Every teenager's going through it. Just keep that open door for conversation. And therefore, a child will never be afraid to ask questions or be kind of open and honest about what he or she is feeling. It's important to use correct anatomic terms for multiple reasons. I mean, you want your child to be using correct terminology and out there when they're in the world, and that can be really important for safety as well. You always want them to know the words and the language to use to describe anything that may or may not have happened to them. But you really just don't want there to be any confusion about what these parts are, what are the correct words, and how to advocate for themselves. And then make it simple. I think sometimes we forget just how much things might have to be broken down, but using simple, concrete language, saying it the same way every time. It might take a lot of repetition to build some of these habits, when it comes to hygiene, for example. But keep at it and keep it basic and direct. And for the visuals, a lot of kids with developmental differences love and benefit from visual schedules, getting to see that checklist of what I need to do to get ready for school in the morning. Social stories. Some of you may be very familiar with social stories. Some of you may have never used a social story. I'll show you an example, but again, a visual representation of a certain topic or thing that might be challenging for them. First, then, boards are great. First, I do this, then I get to do this. And we'll show some examples. And then public-private. So this is another example that came from the Healthy Bodies Toolkit and can look different for every child. But you put up kind of your own public-private visual that you guys create as a family. You can put your own pictures in there, and then it really can help the child see where is a public place, where is a private place, and what do I do in each of those domains. And again, I'll just stop talking and show you the visuals because I think that's the most helpful. So this is an example of a first then board, and these can be made. You could have Velcro, you could take them off and on and mix up the pictures. There are pre-made pictures in the Healthy Bodies Toolkit, or like I said, you could get creative and make it an activity with your child and make your own. But this would be an example of like how to promote kind of healthy activity level throughout adolescence. So first we exercise and then we play our video games. And so there's that reward at the end of it. And they know they got to do this other behavior first that maybe isn't as enjoyable. And, exercise can be anything from walking around the block to, one of those small exercise trampolines or some type of dance video game, if that's what they like. But I think really trying to promote some activity beyond that sedentary lifestyle for these kids who are at risk of that. This is another example, again, from Healthy Bodies, specific to young women who this might be a way that your child's able to, if they're nonverbal, let you know, do they have any pain? Whether it's the smiley faces are usually kind of the basic level, or they might be able to mark it out on a bar graph depending on their cognitive ability. And then this, so you can maybe envision like a little key ring going through here. And this could even be like a little pocket reminder for them to keep in their bag, their backpack, to help with independence in changing their pad or in doing kind of the day-to-day care for their menstrual cycle. And again, every child, it kind of depends on where they are, how much of this will have to be done by someone else versus how much they are able to do independently. But a lot of children practice, repetition, having that little guideline can take on some of these tasks independently. Okay, so this is an example of a social story that is, again, part of that appendix of resources. So you can see this one's kind of pre-made. You could make one that is specific to your child and actually use their picture, their bedroom, their bathroom, a picture of their shower, things like that. But so for example, you would, this story, you would just read the text. So public places are where other people can see me. Private means away from other people, like in my bedroom or bathroom with the door closed. Everyone has private parts of the body. I can tell what parts of my body are private because I cover them with my underwear. I don't touch my private parts in public or other people can see me. And I don't ever put my hands inside my pants in public. I can help myself remember not to touch by putting my hands by my side, crossing my arms, or folding my hands. Sometimes I need to touch my private parts, like when I itch or my underwear is uncomfortable, and I can ask to go to the bathroom. When I am alone in my bedroom or bathroom, I can touch my private parts. And this, I just like read through it, even though it's like kind of awkward again or painful to listen to maybe, but this is kind of the most effective way. Just simply walk through that process and giving the child guidance, both verbally and visually, or in whatever way is best for your child or your student, just giving them that guidance to know what to do. And that will start to help redirect those behaviors to an appropriate place. Here's the public versus private board that you can make. So could take a picture of your child's actual school, actual bedroom, and then you put other places over here, maybe church or maybe kind after school care. Put pictures of places that they might go on the day-to-day that are public, and then places like their bathroom and their bedroom that are private. And then you put different pictures of activities that are appropriate for public and appropriate for private. And you may have to bring this out often, multiple times a day, every time or every day, or you may not have to use it that much. Again, it just depends on how frequent the behaviors are occurring and how quickly they need to be addressed. Again, from Healthy Bodies, all of these are from Healthy Bodies, which you could go look at right now and print out for yourself if you wanted to. So this is just a picture where if you're teaching basic body parts. And I liked this one because it gives you an idea of how you could both teach what's public versus private, putting a red dot over areas that you don't show to others, a green smiley over areas that are okay to show to others. And and I think that can be really helpful in terms of not only just the child knowing what's appropriate in public versus private, but also knowing what's appropriate for other people. And so you can always emphasize, like, parents, doctors are the only other individuals outside of themselves that are able to touch certain areas of their body. And so that can be also something that helps with social safety. So leading into that, like I mentioned before, we know that there is risk of exploitation. So what do we do about that? So for your child, you want to use, like we said before, concrete terms, use visuals, and there are certain curricula. One's called Social Circles that addresses this issue head on, and I'll show some examples of that. But for others that either teach or work with your child, I put this, education, making sure people are aware of it, talking about it openly, acknowledging that it's a risk, and not fearing asking your child about it, and just opening that door of communication, giving them the language to use to be able to describe it. And so I think those are kind of the main ways that we can, proactively think about that. And this is the curriculum I was referring to for social safety. So there's one called eye circles. This image is a little bit old. It may have a new look, or it may even have kind of a revised edition at this point. This goes back to what I said towards the beginning about school and the school's role in this. And a lot of schools will put this as a goal on the child's individual education program, their IEP, to really address sexual education and social safety, and kind of learning those appropriate social boundaries. I often advocate for a structured curriculum because it gives guidance as to, how to just break it down and start to address the topic. And then often it will take a lot of practice. Do not get discouraged if it seems like you're saying the same thing every day. That's often what kids need. And it doesn't mean that you're not saying it correctly or not teaching it well. It just means that they need to hear it again. And eventually it will sink in, and they'll start to remember these things on their own. So the eye circles is basically a huge colorful target where you start from the center, which is your private circle. Then there are those that you can hug, and then your far away hug, your side hug people, and then your handshake circle, and who do you just wave at, and then who's a stranger. And so from there on out, you kind of build this visual concept of how close we can get to another person. I also placed social thinking here because it is another structured curriculum that addresses social communication, but it's more targeted for children on the autism spectrum who have intact intellectual skills, perhaps a higher level of language, but who just kind of miss some of the more subtle nonverbal social cues. It's kind of written in a comic book style. Michelle Garcia Winner is the psychologist who created the curriculum, and she has her whole website too. She's a great resource, but it kind of tries to find a fun and entertaining way to present social skills to these kids. And so if someone says this, or someone does this, that might mean that they're not interested, or this is how we should interpret that. So that's the social thinking goes towards more of those social nuances that we want to support our kids in how they understand those. And again, this is just another example of the kind of that same concept of the social circles, the target. This one has more words on it, perhaps for a child who does read or who does better with more verbal language. So there's your romantic partner who you're able to kiss. There's your family who can hug and you help one another. And again, this is something you could create alongside your child. So what are friends? What do we do with friends? You might be able to talk about some private things, but then just your coworkers or your acquaintances, you can talk about fun things, but not necessarily private things or personal information. Acquaintances, you can just say hello and ask friendly questions. But this again is a visual guide to kind of help them put people in their appropriate context. And a lot of families, I will use actual pictures. So of different people along that range, different family members or friends. or in the acquaintances area, you might want to put like prominent people or people that they would run into in the community, like a store clerk or a policeman or things of that nature. And if I haven't talked about the Vanderbilt resources enough, this was actually new to me when I went to their site recently. So they've just published a whole guide on puberty, sex, and sexuality in autistic teens and adults. So there's, again, a PDF that you can print out. And then there's also an online course that it looks like all you need to do is just register. You don't have to pay. You just have to make a login. And this is directed towards the child. So your teen with autism could go through the curriculum on their own. I do advise parents to read through it, see what it's offering, and how that plays into your family structure and values and all of those things. But I think it could be a very useful tool for some of our teens who are maybe quite verbal and have high cognitive abilities, but have a harder time with some of the relationship aspects. I'll also take this moment to say that all of our research and data shows that children with autism spectrum disorder and neurodevelopmental differences do seek and desire relationships. I think sometimes it's a misconception that they aren't as emotional, or they don't care as much about peer relationships, but that's not true. Many articles show that well over 70% of young adults with autism have had one romantic relationship at least, and majority have an interest in lifelong partnership and relationships. So this is my one little blurb, one little slide about bullying, just to say it out loud as something to be aware of. As pediatricians, we should be asking about that at your child's visits. I often ask kids directly, like, has anyone been mean to you, teased, pushed, hit, or made you feel bad or sad about yourself? And so, again, children with neurodevelopmental differences are a little bit higher risk, but sadly, bullying goes on all day, every day for all children. And I just wanted to put this here to let you know that there are websites that have loads of resources, anything from kind of maybe what types of things your school could do versus, how to handle certain specific situations. You can go to those websites, but schools are able to do safety evaluations and staff trainings, and responsibility there to kind of, and by safety evaluation, usually that's kind of looking at the physical environment of the school and locating any areas of danger, and making sure that everyone, feels comfortable addressing bullying, physical bullying, and then trainings for staff around how to recognize it and how to respond. Okay. Hopefully this has been entertaining enough that I haven't bored you so far. During these last slides, I'm going to just show you a few other resources. Again, don't feel like you have to be scribbling furiously to write these down because they will be available to all of you. And then I did want to, there were a few other kind of more specific questions that came through that I'm happy to, since we do have time, to mention. And then we'll wrap up, and I'll look forward to probably many more questions now that I've at least kind of thrown out the basics to you guys. So there are many websites out there that seek to support parents. Going back to what I've said throughout the talk, I really don't ever want you guys to feel like you don't have somewhere to go to find the information that you need, whether that's your provider, your school, or any of these resources out there. So this is Brainpop Jr. So this is kind of some basic topics that are presented at maybe perhaps a younger developmental level. So taking care of our teeth and our bodies, safety, being responsible. I do think this one is a subscription service, so there's a cost associated. But if it is something, they have some examples that you can look through and see if it's something you're interested in. There are also plenty of resources that are not associated with a cost. But this is one that has just some really nice visuals. Kids Health is put out by Neimers, and it has, again, parents, kids, teens, educators, topics, anything you could ask for. And there's a whole section on puberty. RaisingChildren.net is out of Australia. Also has excellent resources specific to puberty, menstruation, anything from the physical to the social aspects of the teenage years. And I will say, several of you had questions about children on the autism spectrum and what to do when they're kind of perseverating on asking out a certain girl in their class, or maybe get kind of really perseverative on, things they see on the internet, like hypnotizing girls and wanting them to like them. And I think the first is just going back to what we said, talking visuals, making them aware that that behavior is not appropriate, or that trying to frame for them how the other person may be feeling. Children with autism don't naturally think about like other people's perceptions as readily. So just giving them like concrete information, like she feels this way when you do this. And then giving them maybe some other way to redirect that behavior, helping them think out what can you do instead, or just starting by saying like, today you're only going to ask twice. If they're kind of trying to ask the girl out 5 times a day, first goal is like, let's go down to 4, and then kind of have some reward or some motivating factor to drive that. But all that to say, that website there addresses this topic specifically, as do some of the literature from Vanderbilt that is geared towards teens with autism spectrum. This is an example of social stories from Autism Speaks. And again, small cost associated with these, but if you don't want to make your own and just want to, get one quickly, you can always order and download social stories from sites such as this. A Google search of social stories will probably provide you with several options. And these are some books that different like psychologists and school providers have recommended to me that are good ones for kind of, when you're thinking about how do I even talk about sexual intercourse. And again, Vanderbilt and those other websites that I just mentioned are other great resources to give you some like step-by-step, even like a script where you can, read it almost verbatim. Like if you just are like, I just need someone to tell me how to say it or what to say. Those things are available. The American Girl, Care and Keeping of You is a nice body book for girls too. Okay. I'll go ahead and stop sharing my screen so you put it back on my face for the remainder. But I wanted to, in these few minutes, I'll address a few other questions that came through that I thought were really, really good ones. And so one is this, the question of gender identity. And so wondering like when should we be concerned about gender curiosity or bisexuality in my child? It's a topic that we're still learning a lot about, particularly in kids with neurodevelopmental differences and autism. So I'm by far no expert on this, and I'm still learning, but I do know that so far the literature as we've looked into this for children with autism specifically, suggests that they do have a little more confusion. And we think it's because children with autism tend to be very black and white and literal. And so if they have a thought or a brief thought about the same gender, they might think, well, because I had that thought, does this mean that I'm this way or that I have a same-sex attraction? And they have a harder time with ambiguity, or the kind of the fact that kids during teenage years have a lot of thoughts, a lot of feelings, and they're not necessarily permanent. All that to say, our clinical guidelines thus far are to be just to be cautious in kids with autism. Don't feel like you have to push the issue. Don't, if they make a statement, entertain it, talk about it. Don't provide a reaction that then makes them afraid to speak about these things. But just to be comfortable with like a little bit of confusion around that for a while and well into their young adult years, because it's a concept that's a little bit harder for some reason for children with autism. I know it probably doesn't feel like a satisfactory answer to that, but we're still learning. But that was an excellent question. And then I know some of you asked about like non-traditional tests, like organic acids, hair and stool analysis, to see if there's any abnormalities related to perhaps an increase in tics and stimming that you've seen during puberty. The first thing I'll say is that we do often see a worsening of certain behaviors whether it's aggression or tics or some of the stimming and repetitive behaviors, which is, to me as a researcher, is fascinating because there is something about the hormonal changes of puberty that are impacting those behaviors. On the other hand, some children do better when they hit puberty in terms of some challenging behaviors. So I don't have an answer as to why that happens. I will also say that we don't regularly do non-traditional tests. We will measure organic acids and amino acids in children when we're concerned for a metabolic diagnosis or disorder. That's usually, we're alerted to that usually at a very young age due to them being constantly sick and having a lot of medical concerns. So we don't typically perform them on a regular basis. We don't know what to do with the information. And so it's putting your child through a test that we then don't know what to do with the data that we get back. And some of you had some great practical questions too, like for a child who's incontinent and is an adult. And so how do you diaper them during an erection? And to be completely honest, that I thought I have never thought about that. And so these are the things you're facing day to day as caregivers. And so you kind of taught me in that regard. And I don't have any perfect answers. I do know that in terms of just like friction and rubbing on the diaper, zinc-based ointments are helpful for that. I think someone also asked, like, how do you know if discharge is unhealthy other than like foul smell? And to be honest, foul smell is one of the main causes. If the color changes or if the amount or frequency of discharge changes, that's another sign that there might be something going on. But if you ever have any concerns, don't hesitate to make an appointment with your pediatrician and just ask your provider. That's our responsibility to take a look as a medical professional and tell you if that's normal or abnormal. And then I think for diapering during an erection, and I know I saw several folks who suggested just like lying the penis flat to the stomach and then using a high-waisted diaper. But I'm sure that's an area where I'm sure people who have more experience, like some of your, if you guys are a member of any family groups, if you learn anything, please let me know. Sometimes the best way to find out is just to ask people who have also tried and experimented with different things there. And then one of you asked about Fragile X premutation, which I know might not apply to all of you, but was asking if that might be impacting your children in terms of their behavioral symptoms and autism. And we do know that children with the premutation have emotional and behavioral and learning diagnoses at higher frequency than those without. So hopefully that answers your question, that it may be contributory to the behaviors that you're seeing in your kids. And then hopefully, I think I've answered most of the ones that came in before. And I hope that through this talk, I provided you with some kind of first steps, some resources, some basic things you can do to start to broach this topic with your child or family member or student. And then another question was, how to get in to see me. And I would love to see any and all of your kids or students. There is a process if you want your child to be seen at the Meyer Center, and it all begins with your pediatrician's referral. And I will stop there and let Dinah weigh in if there's any, kind of from there in terms of like, if you're interested in a referral, like how that would happen.
That actually, thank you, Dr. Harris, for that, because I wanted to just give a little bit of information on both that side and also the adult side. So for our clinic, we are primarily a diagnostic clinic. So we do evaluate children for autism and other developmental disorders. So we are a great fit if you've not had evaluations. If you've had an evaluation, you've known your diagnosis for years, you probably don't need to come see us. But we also have educational programs such as this one for our families. We have activities that our families and people in the community can participate in. So I always encourage people to sign up for our newsletter, which I think Miranda has information on that, but you can also go directly to the Meyer Center for Developmental Pediatrics website, which is part of the Texas Children's website, and there's a link to sign up for the newsletter there. Now, if you're interested in coming to our clinic for an evaluation, if you do need that, the phone number to start the process after that physician referral is put in is 832-822-1900. That's our referral center. They process the referrals and tell you what you need to do at that point. But if you are a parent of a young person who is approaching adulthood and you've had wonderful pediatricians who understand how to explain things to you, but you're looking for adult doctors who also understand about how to work with people with developmental disabilities, I wanted to put in a quick plug for the Baylor Transition Medicine Clinic. Some of you were asking some medical questions, and I don't know, the ages of your children, but they are a great resource if you're looking for a primary care provider who knows how developmental disabilities affect medical conditions and vice versa. So I do highly recommend them as well.
Thanks, Dinah. And I do hope this was helpful, and please send along questions, suggestions, things I didn't cover that you still would have liked to see, because again, like I said, I'm no expert. I'm also always trying to learn myself so that I can know what is beneficial to the families that I'm speaking to. And I think I'm right up at time. I figured this might happen, which is why I had you send in your questions. Miranda, I'll turn it over to you.
Yes, thank you so much, Dr. Harris. That was quite informative. I just want to go research everything that you talked about already. I am going to be sending a survey out to everyone. So if there's other questions that you would like addressed, please go ahead and submit those in the survey.
And on that note.
So we're going to go ahead and wrap up the meeting for today, and hopefully we will have Dr. Harris and Dinah on other educational sessions in the future.
Thank you for inviting us.
Yeah, thank you guys. Thanks.
Thank you.
Thank you all so much for participating, and we'll see you next time.
Thank you. Bye.